Yeah, well, thank you all for joining us today. It's great to be back with you all for the final webinar of our three-part series on the substance use crisis in Massachusetts. Yeah, we appreciate you spending another morning with us. So I'm Mark Fine from the Metropolitan Area Planning Council, and we really appreciate the ideas and insights all of you have provided as we have progressed this series, since January. As you know, when we started the series back in January, we really took a look at what the state of the crisis was in Massachusetts. From there in February, we then discussed challenges and solutions that local government, social service, and healthcare partners have been working on. And in today's session, we have some great partners and presenters joining us. And we're going to look forward also to discussing funding and action steps that can be taken to address this ongoing crisis. So today's session is going to be probably a bit shorter than the two previous ones, but it's also going to provide an opportunity for you all to interact with each other in some breakout sessions in the second half of the session. And that's going to give us a chance to, think about what we learned through the series and what more needs to be done to address the crisis. So we'd love to, have you all, be able to participate in that and, share your thoughts. About where next. But before we move to breakouts, let me just go through the run of play. We are really pleased to have a great local leader join us today, Malden Mayor Gary Christensen, who has been a tireless and innovative champion of programs to help people suffering from SUDS to receive the support they need. We will also have a presentation on the Opioid Settlement Funds from our own terrific public health planner, Claire Hoffman. And she will give us some information around what communities can do on the with the opioid settlement funds and what some of the communities are already considering. And then we will go into the breakouts probably for about 20 minutes and conclude with Deborah Schmel, who, as you'll recall, if you've been with us for the two prior sessions, Deb, she was the opener for our January session and was really the driver for us offering this event. And, we're glad to have her back to offer some concluding thoughts today. And I think at points in between these pieces, we will also share some thoughts on policy for consideration and things that, we might look at collectively to address this crisis. So that's what we're going to be doing today. It's great to have you all back with us. And now, I want to invite Mayor Christensen to join us. Thank you, Mayor, for being a part of this. As I said before, Mayor Christensen has been a great leader in supporting people with SUDS to receive support, treatment, and enter recovery. Malden's doing some really, creative things, and he can share the work they have done in Malden and also some thoughts on what more is needed to sustain and expand these services. And thank you for joining, Mayor. I have some questions, but you can feel free to riff off those too. and
if I could first, Mark, what I would like to do is really thank you, Deb, MAPC, and everyone on this call, because what I have seen is most important over the past several years is what you're doing, which is talking about it. Prior to us coming together on a plan here in Malden, we just always didn't acknowledge and honestly didn't know what to do. But again, thanks through webinars like this, we now know what to do. So hats off to you all.
Yeah, no, we appreciate it, Mayor. I mean, in some ways we're learning, we want to be able to spotlight some of the great work that our communities are doing, as kind of a way to share, with other communities so they can either duplicate or follow and learn from each other. So thanks for joining. I mean, I guess, maybe just kind of building off what you started with, you kind of talked about like where you were before you you kind of had a plan, and then you decided we're going to make this a priority and really try to address the issue. So how did that happen, and what kind of led your administration to make it a priority and focus?
I meet with our police chief every Tuesday morning, and as we went through the stats, we were noticing a trend of overdoses and fatalities from those overdoses. And so thankfully we had someone on staff who not only worked in the field of recovery, but was in recovery himself. And so he left what he was doing here for us to spend full time his energy to do everything he could to help with this really critical issue. And so now he is our full-time addiction recovery resource specialist. And he's not alone. In addition, we've added 2 part-time recovery coaches to assist him in doing everything we can to prevent overdoses and ultimately fatalities. So he is out in the field attending different events. As a matter of fact, he would have been here today. His name is Paul Hammersley, but he is in all of our schools today as part of Malden Stop the Stigma Day. And what him and the rest of the volunteers are doing is just trying to educate as many of our students as possible to not become entangled in this insidious disease. So I would just say to everyone, beyond having someone like Paul on staff, it's really just about determination and commitment. As we all know, there's a plethora of issues out there to work on, and you just have to prioritize them. And for us, this is a top priority. And so again, we have 3 people on staff, and they're working on this issue year round for us.
Yeah, I mean, that seems critical. I mean, it sounds like as far as who you rely on it and the folks you've kind of built your programming around, it is people with lived experience.
Yeah.
And maybe if you want to maybe talk about, why that's so important, in what you do.
Yeah, I think for a lot of positions in local government, you can shape people, you can mold them. But for this one, we really felt it was important. You had to have someone who lived it, who has been in recovery. And so not only is Mr. Hammersley, who is our full-time recovery coach in recovery now, a little over 20 years, the 2 part-time recovery coaches are as well. So, we thought that was critical at the outset, that you have to have someone that can relate to the families that need the help. And I can say now, looking back several years, because they've been in these positions since I think 2017 now, it has really helped make that extra difference. Because when people learn that they themselves are in recovery, it opens up the doors a little bit more for them to get the help that they need. And so that has really been, I think, if anybody on the call is looking to do that, I would highly recommend that you have someone who has lived it.
No, that makes a lot of sense. I mean, and I guess maybe, when I think about what Malden's done in the community, sure, I mean, Malden is a really diverse and growingly diverse, community. I forget what the stat was around how many different languages are spoken, in the schools.
75 at the high school. And
Yeah,
it's the high school, to give you some sense, is the #1 diverse school in the state, 6th in the country.
Wow.
Yeah.
That is something. So yeah, I mean, it's, a rich, patchwork of cultures and languages. And I guess maybe thinking about, these type of issues and kind of the population and how diverse it is, like, how do you kind of ensure services or even the message gets out to, folks from such a, different backgrounds and who also might receive it differently, right?
Right. I would say it's through events like today. So Malden Stop the Stigma Day. Paul and his team are in front of 6,500 students who, as Mark mentioned, are from an array of cultures that are being exposed to what to do and what not to do. The other thing that we do, we collaborate with a lot of nonprofits here in the community. So recently there was a Faces of Recovery project at the YWCA. And so the students there, who come from all kinds of different backgrounds, worked with people who were in recovery. So they were able to hear the stories and how they overcame this issue and are now contributing back to the community. So efforts like that, we spend time in the houses of worship in Malden, which we have several of them. We have a standing team at the warming center, which provides a place for people overnight who have nowhere to go. So they receive recovery services as well. So it's just an all-out effort. That's what it takes. I don't think you can do this sort of half and half. You really have to be all in on it, I think, to have the effect that is needed to make a change, to make a difference.
Yeah, I mean, it seems like, you are, like utilizing a lot of the partnerships you have for a range of issues, but then for this one as well.
Yeah, we actually have now a street team. So when the weather turns, we'll have a team at the Malden Center train station. We'll have a team at different housing developments across the city. And what we do is we now have a standing opioid task force that meets monthly. And we look at the trends from those police reports that I was talking to you about earlier. And if we see an area that is rising or is having an epidemic, we will send the street teams out to those areas, and they'll set up shop where people walking by or driving by, they'll provide them with a phone number and an email and, how to take that critical step forward to get help.
Yeah, no, and who are the people on those street teams?
It's Malden Care. So fortunately, through the American Rescue Plan Act, we've been utilizing some of those funds to establish these street teams to get out into different parts of the city that we normally wouldn't be able to do. I mean, we would be able to do it through volunteers along with our staff, but we're able to do so much more now having these funds available. And then what we're anticipating is when those dry up in a couple of years, we'll try to see if we can utilize some of the opioid settlement funds to continue the program forward.
Yeah, I mean, that sounds really important, being able to maintain that, because
Yes, yeah,
that work is, doing some really good things out there.
yes.
And I mean, maybe just kind of touching on sort of the range of programs and just how it intersects with other issues. I mean, one of the areas that, a lot of people are talking about is just the, kind of intersection between, housing and substance use issues. And that was something we talked about at the second session a bit. And, especially like the need for, transitional and permanent supportive housing, low threshold housing, that helps people off the street and into housing without necessarily requiring they stop using, sort of like a housing first approach. And I was just wondering if maybe you had any thoughts on kind of the intersection of substance use and housing. I'm sure some of the folks that your street teams and other people are dealing with are people who are in some degrees of housing distress, and need support on that front too. And often I think the theory being that, if you can house somebody, they're much, that stability that provides will enable them to, take those next steps towards treatment and recovery. Any thoughts on that? And maybe
I would say, Mark, I would say the bigger one is mental health. It's ironic that you're asking me this question, because at our last opioid task force meeting, which was Thursday, one of the issues that came up is the possibility of looking to add a mental health clinician to City Hall, who could then go out with these street teams, who, when they encounter people in need of help, what they're finding is not only is it recovery help, but it's also mental health help. We have someone already in the police station, but it's not enough based on what we're seeing. So we're contemplating whether or not we might be able to do that. So I would say that then when it comes to housing, I mean, that's just as important of an issue, but we're really seeing mental health is the big one. And, thankfully, Counselor Amanda Linehan, who works with you, has stepped forward to lead an effort for Malden to establish a 144-bed behavioral health center, which will be owned by Tufts Medicine and run by Acadia Healthcare from the South Shore. So we're hoping to have that up and running in a couple of years, which would help address what we're seeing in all four corners of the city when we're responding to calls, is the need for mental health services.
Well, that sounds like, an amazing resource. Yeah, no, that's really great to hear. And definitely, yeah, mental health. I mean, there's so much of a interplay between mental health and substance use disorders. And yeah, it is definitely a trend that more communities are hiring social workers and clinicians to support the work they're doing. So it
Yeah,
sounds like that's something you're looking at as well.
yeah, I haven't told our finance team yet, so don't do this recording with them, but we think that is the next.
Well, I won't let them know until you do.
Yeah.
Yeah,
But
I mean, I know another kind of important resource in Malden is the Bridge Recovery Center, which opened in, I think, 2021. And, I think, as people on the call, whether you're familiar, whether they're familiar with recovery centers or not, maybe you could talk about, just, what it took to make it happen and also what it provides. Um, and, and maybe what the role of kind of the city, the state and the private partners has been to, to keep it running and get it off the ground.
Well, what I can tell you is not what to do, which is you're contemplating establishing a recovery center in your community. Don't do an interview with Fox News.
All
We
right, I
did
remember
one,
that. Yeah.
we did one thinking that they were going to, just state what an important initiative this was, and somehow it ended up that, we were opening up something that had happened in Boston. We were going to take what was going on in Boston at the time and move it here. So once we were able to correct that misinformation, I think people understood that the time had come, that we had to step forward and address this issue. So how we did it was working with our great state legislative delegation, which consists of State Senator Jason Lewis and 3 House Representatives, Altrino Donato and Kate Lipper-Garabedian. It was Paul Broder at the time, and then he became member of Melrose. But it was a team effort. So the city council, our office, the state delegation, Malden Overcoming Addiction, Paul Hammersley, and actually the private sector stepped up too when it came to working out the terms of the space that were going to be used for this center. So one thing I could tell everyone, it's just an all-out effort. You can have a recovery coach on staff, but it's not enough. You can have street teams out in the community. That's not enough. You have to, for this insidious disease, we've gone to a lot of wakes. It's just horrible. And that's why, again, we've made it a priority to do what we can. So the one thing that happened was, as Mark was mentioning, we'd get the calls and we would respond, but what happens after that? And so we felt by having a recovery center, a peer-to-peer, where people could go and have family support, could, be in a place that was safe and provided resources to help that transition away from substance use abuse. That was the next step. And so we've had this center up and running now for a couple of years. I think we opened it in 2019.
Oh, 2019. Okay.
Yeah. And again, it's been another great resource for us.
Yeah, I mean, I know, and we had always kind of noticed that there wasn't a recovery center kind of north of the Charles, right? In sort of, your region. So, having that access is really important, and having, I think that is something that other regions that might not have a similar resource should think about, and can learn from your experience. And I know the state does provide some level of funding to support that.
Yeah, very competitive, but I could tell everyone on the call, once we provide our help, and it's limited. We go there, we try to provide resources, we'll try to get people placed, but it's what happens after that. And so as Mark was saying, you have to have that continuum of care. And so this place, which is just down the street from City Hall, so it's really centrally located, accessible by train, by bus, walking, driving, has filled that gap of when we do our initial intake and provide those resources up front. You have to have something on, from what we've seen, on the back end to sustain it. And that's what this Bridge Recovery Center does.
Yeah, I know, that's really, really amazing. And I guess, you started touching on the opioid settlement funds, and, we'll obviously be talking about that more when Claire does her presentation. And it sounds like some of what you want to do is kind of be able to sustain some of your current programming using those funds. Have you guys thought about any other ideas for maybe what you might do with those funds?
Yes, we're looking at the possibility of establishing a woman's sober home. So we're not sure whether or not those funds can support that, but that is our next big goal. We're pretty good on the men's end of things, but we're seeing a need for more women's homes. So that's what we're looking at next.
Oh, wow. And that would be an actual facility for that
Yes.
purpose. Yeah. Like a
Yes.
site.
Yeah.
Yeah, because I know some of what your programming is always supported are like sober home scholarships and
Yeah.
trying to help people with some of the money they need to get into sober housing. But this sounds like an actual location and site for that. That's
Yeah, we're actually looking at properties as we speak.
wow. But yeah, we'll love to hear more about it as your effort progresses. Is that generally what is? I wonder if that's a bigger problem across the state, just the lack of sober housing for women in need.
At least we're seeing that here, and even sober housing in general, the ones that do exist are far away, and sometimes we find that to be a challenge.
Right.
For families having to split up. So, we're looking at seeing if we could do more in that area.
Yeah.
Going forward.
Well, that sounds really, really interesting too. And I guess maybe you touched upon the Stop the Stigma Day and how you have a big day engaging young people across, the city. And I guess maybe, building on that, like what do you think are further opportunities to engage your schools and youth programs in preventing substance use disorders?
Yeah, we just announced last week that every Thursday we're going to be in the high school health center. We're going to have a recovery coach there who is going to meet with students who may be experiencing or have a family member who's in need to provide resources to them. So that's our newest initiative that we just started this month.
Yeah, I mean, that sounds pretty amazing. I guess it touches on, like an issue, beyond young people themselves experiencing, substance use disorder for young people who have family members who are, and how tough that would be for them. That sounds like a really important, kind of, recognition to provide that support.
Yeah. And Cambridge Health, who helps us administer our health center, was great about it. So we just opened in September. So to have this in place in the first year, I think is a great step forward for us, because we really want to do everything we can for the students.
Yeah, no, I mean, that sounds amazing too, as far as the range of things you guys are doing, across your community. And I guess maybe one last question for you, and that would just be about, doing what your city has done. And none of it was easy, I'm sure. Each initiative, took a lot of steps, a lot of, bureaucracy and, hurdles to overcome, some of those being political. I mean, I guess if you had to think about any policies or procedures or even, processes that you would love to see change to make it easier for communities like yours to do the things you want to do to address this crisis. Anything come to mind on that?
Nope. I would say it's all about determination. It has to start, from within. And if you have that, that's all you need from what I've seen. There is no policy or procedure or rule or protocol. It really is about energy and passion and commitment. And that's why I want to just reiterate how important it is what you're doing here. I mean, it's Wednesday morning, could be doing something else. The fact that you're here keeping this issue front and center is what it really takes, I think.
Yeah, well, no, and I mean, I guess if anything, it seems like a lot of what you've spoken to is just how important having those champions are, and and champions, not only at the, your level, the executive leadership, but then also, champions within, city government, within the community that are willing to, put in the legwork to, to see these things happen and keep them going.
Yeah, Mark, it's, such a priority for us. We just delivered our State of the City address last Wednesday night. If people want to see it, there's a section in it on this topic. And I just wanted to let people know that's, 10 years ago, it was just public works, police, fire. But because we have made this a priority, this now has its own section in our State of the City address. So people want to view it, you can go to YouTube and just look up the City of Malden 2023 State of the City address.
Yeah, I mean, I think just seeing it as a important part of what city government does. Local governments didn't necessarily always see this as part of their responsibility or role. And I'd say, that's changed in the last, 5 to 10 years. But I mean, I think one of the reasons we wanted to do this session was because, there is always the concern that because this just crisis continues, people just treat it as, something that just happens and we lose sort of the urgency around it. So, it's great to hear that that certainly is not happening in Malden, that you were treating it, with the level of importance it deserves now, as you had 5 and 10 years ago, and, will in the future.
Mark,
So,
I would also say to everyone, which is very important as well, you need to have everyone be a part of it. So at these opioid task force meetings that we hold monthly, it's not just me and our recovery resource specialist. Also at the table is our police chief, our fire chief, our health director, a pastor who represents the houses of worship. I mean, it's a real collaborative effort. And, what's resulted from that now is when the police see something happening, the first call they make when they encounter someone who was overdosed is to the addiction recovery resource specialist, who then goes to the person's home and just lets them know that we are a resource. Here is how you can get in touch with me. Here's what I can do. We just started getting into harm reduction. So we're now providing fentanyl tests. So if someone is going to continue to use, they'll now be able to test what it is they're using in the hopes of preventing fatalities.
Yeah, no, I mean that, that kind of all of like whole of government sort of approach seems like, critical here. And I think there's, Malden's a good example of that. And there's some others in our region, definitely. But yeah, I mean, it can't just be the responsibility of kind of one person to, deal with this. And,
Right.
It's great that you recognize that and have been pulling the team together.
Yeah, and I saw someone wrote in the chat, their family members, the people that are on the task force, there are people not only in recovery, but they have children as well. So they're parents and they have lived it. So that's why it's critical. You just can't have people who have not experienced this be part of the solution. You have to have people who have seen it all, leading the effort.
Yeah, no, that seems critical. And I would say just for, we've had a lot of, great comments and questions in the chat. I don't know that we have time for all those today. I would say bring some of those comments and questions into the breakouts though, because those can be, shared there. And we also are capturing, what we find in the chats and the resources and things people are posting. So we'll be able to, make that available to, webinar registrants, at a later point. But Mayor, it's been a real privilege to have you with us today. It's great to hear of the wonderful things that are happening in Malden, dealing with what is a hugely difficult issue. And folks, now that you know where where to find Mayor Christensen, feel free to reach out to Malden if you have any further questions about what they've done and how you could try to follow their lead.
Thank you.
Thank you so much, Mayor.
Thanks, everyone.
Well, yeah, that was really great. And what we're going to shift to now, and I think building on some of the themes that the mayor talked about, is just a presentation from Claire Hoffman, who's, as I said, our public health planner at MAPC. Just on the opioid settlement funds and what are some of the ideas that communities are considering in using those funds, and how that might happen. So, Claire, over to you.
Thanks, Mark. And thank you so much, Mayor Christensen, for sharing all of the wonderful initiatives that Malden is doing right now. I am going to begin sharing my screen. Can everybody see that? Thumbs up, great. So as Mark said, I'm going to be sharing some information about the opioid settlement funds that are coming to Massachusetts. We're in a very exciting period of time and somewhat rare for public health, where we actually have an influx of funding to actually address this issue. And so I wanted to share some ideas about how to deploy the funding and some overall information. So as some background, Massachusetts will be receiving over $900 million in opioid settlement funds. The funding will be distributed annually for a specified number of years per each settlement agreement. For example, the distributors and Johnson & Johnson settlement agreement will be distributed annually until 2038. And it's really important to fund public health approaches to the opioid crisis. Over the past 3 webinars, we've heard about what some of those public health approaches are, and we know that they work, so it's really important to fund them. I wanted to bring this to your attention. There are new opioid settlement funds available. There was a new settlement that was released, I think, in December, January, with some pharmacies and manufacturers. And you have to sign and return participation forms to receive the settlement funding by Tuesday, April 18th. So make sure that your municipality has done that in order to receive the funding. This is probably some background information for you all, but how are these funds being distributed in Mass? 60% of them are being allocated to the state's opioid recovery and remediation fund, while 40% of them are being allocated to municipalities to expend on state-approved abatement strategies. And I'll be focusing my time talking on about that 40%. And I also wanted to highlight that municipalities are allowed to pool resources to advance regional strategies and collaboration. This may be particularly important for the smaller towns that are receiving less funding. So before I go on, I just wanted to ground us all in the continuum of interventions. I shared this slide during the first webinar in the series, but there's a lot that we can do to address substance use disorder. There's things like primary prevention, such as doing school-based interventions and many other things. Then there's early intervention or secondary prevention, and that's kind of early detection of substance use disorder through things like screening and brief intervention. And then there is treating the issue, which is tertiary prevention. And those are through interventions such as treatment and harm reduction. So I'll be touching on the spectrum throughout the presentation. So I also wanted to share just some overall principles for use of funds that you can use to kind of guide your thinking as you decide how to deploy the funding. And these were adapted from Johns Hopkins University. And the 5 principles are: spend the money to save lives, use evidence to guide spending, invest in youth prevention, focus on racial equity, and involve people with lived experience in decision-making processes. So the first one is spend money to save lives. As I wrote here, municipalities may be tempted to use the dollars just to fill holes in budget rather than expand needed substance use and mental health programming, but the funding really should be used to supplement rather than supplant existing spending. So you should be looking at your landscape and your municipality and region and asking the questions: what programs are working well and how can we bolster them? And where are there gaps in that continuum of interventions and how can we fill those gaps? The second principle is use evidence to guide spending. there's a really large body of evidence describing what interventions work well and what don't. So we really should just be funding those that are working well. And so I've listed 3 resources here that have libraries of evidence-based and evidence-informed interventions. I think that these are really good. You can filter them by kind of demographic and the outcome that you're hoping to achieve. So I really encourage you to take a look here, and we'll be sending out the slides after the presentation. The third principle is invest in youth prevention. We know that substance use in childhood and adolescence is a strong risk factor for developing a substance use disorder in adulthood. So it's really important to focus on primary prevention to interrupt those pathways. And again, I've included some resources that are specific to youth prevention. Again, you can kind of filter these by demographic and setting, and it will list a bunch of interventions that are really effective in terms of primary prevention. The next principle is focus on racial equity. During the first webinar, I shared this graph, and you can see that Black, non-Hispanic, and Hispanic populations are experiencing an increase in opioid-related overdose death rates. These are the same populations that were unjustly targeted by war on drug era policies, which led to criminalization and incarceration. And so it's so important now to invest in these communities that have been affected by discriminatory policies. So review state and local data about racial disparities in fatal and non-fatal overdoses, and support diversion from arrests and incarceration by providing community-based supports. I'd also encourage you to talk to your medical providers to see if there's equitable access to treatment for opioid use disorder in your community or region. Black, non-Hispanic, and Hispanic populations, unfortunately, use buprenorphine, which is a medication for opioid use disorder, at lower rates than white non-Hispanic populations. And so we really want to make sure that there's equitable access for everyone. And then the last principle is involve people with lived experience in decision-making processes. I think this one is so important, and this is something that Mayor Christensen really highlighted as well. And so we really need to be speaking and involving people with lived experiences in conversations and asking them questions about what's working well for them in their communities and what else is kind of left to be desired. So determine areas of need by asking about their experiences and together looking at the data. I've included some questions that can kind of guide these conversations here, such as what groups are not being reached by current interventions. Are there certain geographic areas that would benefit from specific programs? And on the spectrum from prevention to harm reduction, what services are missing in our municipality or region? I will also note that the Bureau of Substance Addiction Services recently said that they will be contracting with a community engagement vendor who can help lead some of these conversations for you all, and that they're also going to be compiling contact information for organizations that can help get you in touch with people with lived experience locally. So now I'll transition to talking about some ways you may want to consider deploying the opioid settlement funds. And I've categorized these based on the seven categories that are state-approved strategies for municipal uses. I have kind of highlighted ones that I think are particularly innovative or have worked well in other states or locally in Massachusetts. So the first strategy is around opioid use disorder treatment, and that includes medication, behavioral health interventions, and recovery services. So some things that your municipality may want to consider is employing peer recovery coaches, such as Malden does. We heard about how successful that is working out in Malden, and to support mobile intervention services. You could also consider providing capital expenditures to rehab and expand facilities that offer treatment for OUD. The next is support people in treatment and recovery. And the state really means by this, including wraparound services, social services like housing, transportation, and employment, and other community-based services. So some ideas here are to provide rental and utility assistance. This is something that is state approved. You can also partner with social service providers and other community-based organizations to fund job training, job placement, and childcare programs. And again, rehab properties appropriate for low threshold and recovery housing. You're also allowed to use the funding to provide transportation to treatment or recovery services and to create or expand peer recovery centers. The next category is connections to care. And this is really at that secondary intervention point. So it includes interventions and connections to care for individuals at risk of developing SED. And some ideas here are to invest in youth mental health first aid training or just mental health first aid training for general population. And this teaches participants ways to help someone who may be experiencing a mental health or substance use crisis. There's also something called safe stations, which I know Fall River is currently operating. And this is where individuals can go to a fire station and speak to a trained staff member who will immediately get them connected to either treatment or recovery services. And this is meant to be an alternative to kind of calling 911 if somebody is maybe hesitant of engaging with police departments. The next strategy is around harm reduction, and this includes efforts to prevent opioid-related death and illnesses. I could have listed 20 more interventions here. There's so many different ways to promote harm reduction, but here's just a select few. One is to approve and fund syringe service programs. We know that these are highly effective. They can reduce substance use related infectious disease by up to 50%. You can also fund mobile units to provide harm reduction services. In other states, I have seen that they're operating harm reduction vending machines, and these are vending machines that provide naloxone, condoms, sometimes syringes. You can see a picture of this on the right. Could also be a good opportunity for a public art project, as you can see by this colorful picture. You can also fund nalox boxes, and these are kind of like first aid boxes, but have naloxone in them. And you can put those in areas that have are kind of overdose hotspots. This is something that Cambridge is currently doing and working on. You can also fund things like street outreach teams, like the mayor described, and post-overdose support teams, or teams that follow up with people who have recently overdosed. The next strategy is to address the needs of criminal justice involved persons. I'll highlight a couple of strategies here. One is alternative responder models, such as the Boston Emergency Services Team, or BEST, in Greater Boston. And this is a crisis intervention team that has its own hotline number and can provide immediate support. And then you can also provide case management post-incarceration to connect individuals to treatment, housing, and social and medical services. The next is to support pregnant or parenting people and their families. This is something that I saw come up in the chat. One program I'll highlight is First Step Together, where it's a home visiting program that supports parents in recovery, and each family is connected with a family recovery support specialist. Currently, there's only one First Steps Together program in Greater Boston that's operated by Jewish Family and Children's Services in Waltham. So there's definitely opportunity to support more of this programming. And then the last one is to prevent misuse of opioids and implement prevention education. This includes things like youth prevention, anti-stigma campaigns, coalition building, and just providing overall community services. Again, there are many, many different things you can do under this category, and I'll just highlight a few. One is by providing substance use and mental health curriculum in schools for students of all ages. I was recently doing focus groups in Gloucester with high schoolers, and they really described how they would benefit from having this curriculum start early, even in elementary school. You can also fund family skills training interventions, which are meant to kind of strengthen family units, can support community coalitions and strategic planning for substance use prevention, and then providing school-based and community mental health supports, such as school-based health centers and teen health centers. Again, something that we heard is happening in Malden. So I know that was a lot of information, so I'll just leave you with a few key takeaways. One, these were only a select number of interventions available. There's many, many more out there. And so it's so important to engage in strategic planning before deploying the funds. Think of what strategy of those 7 you're interested in pursuing, and then how you'll do it. And I'd also say to consider regional approaches, particularly if you're a municipality receiving a smaller amount of funding. It's also very worthwhile to fund a mixture of existing and new programs. Additionally, you should center the voices of people with lived experience in planning and implementation. This will really only lead to bolstering your programming and making sure that it is responsive to their needs and priorities, and then make sure that the selected interventions advance racial equity. So on that note, I'll see if there's any questions. I'll also leave you with a few resources that you can reference when we send out the slides. Thank you.
Yeah, thank you so much, Claire, for that really comprehensive presentation on possibilities. Yeah, I mean, I think, one thing we should note is just, we're a resource too, and, a lot of different communities that we engage with, they sometimes come to us to share ideas they have and or, learn from maybe, communities that we're working with and trying to, hear about what their peers might be doing. So, we always love to hear from communities about what they're doing, and also to just bring together folks for that type of learning. So I look out for further opportunities to do that. Feel free to get in touch with us, get in touch with Claire. She knows a lot about this. And if you have some ideas you want to bounce off Claire, I'm sure she'd be a helpful resource for communities to do that for. Yeah, so thank you so much, Claire. And one thing, I kind of mentioned we might drop a few policy bits into this. And if there was one I just wanted to come back to really quickly before we go into breakouts, it was just on the low threshold housing subject I mentioned before. For the past 2 years, the state legislature has actually earmarked $10 million each year to enable the Bureau of Substance Addiction Services to finance the leasing of properties and the provision of full wraparound services at these low threshold housing sites. So this is something that states, invested in and started to invest in. And for instance, in Lynn, a new site there is housing up to 50 people, open this year with these funds. And, beyond the housing it provides clinical, medical, food, transportation, job connections and other vital services that enable people to get their lives stabilized off the streets. So, these are sites that, people who are formerly unhoused are able to and have substance use disorders are able to come into. It's housing first, so they're not required to, give up use to qualify for this housing or stay in this housing, and provides that full gamut of wraparound services. So, these are initiatives that have, I think, a good evidence base behind them, and the state has started to support this, but this critical funding doesn't happen without a lot of advocacy and support. And I think, as we all know, even though 10 million does a lot, demand far outstretches the supply of this type of permanent and transitional, supportive housing now. So, I'm kind of just making a plug for communities and others to support this state funding. And I would just say, this isn't just an urban issue. I think people might see it as a issue for communities with large populations of people without stable housing. But, the people who end up in housing difficulty come from all over the region, all over the state. They just may end up on the streets in certain communities because that's where services are available. But they didn't start there, and the solution shouldn't end there. So more low threshold housing is something we need to grow support for across the region. And I know the politics are no doubt tricky, community by community, but I think the reality is clear. And this is something, we definitely want to see regional efforts and regional support for. So with that plug, I'm going to now move us into breakouts where we are going to, talk about, some of what we've learned through these 3 sessions and also some of the ideas we have for, for further action. And I guess, Sasha, you'll put us into these breakouts and then, probably be about, 20 minutes, thereabouts, and then we'll come back to conclude. Thanks.
Thanks, Mark. Folks, I'm going to open the rooms. If you're having trouble joining a room, please let me know and I will manually add you.
But what the heck? Yeah, so thank you all. I thought it was a great to kind of have a chance for different people to kind of just provide insights and thoughts and kind of share with each other. We are now moving towards our conclusion of our series and today's event, and we did want to come back to the individual who actually helped kind of inspired us to do this series. Deborah Schmell, you might, if you were part of the first session, she introduced it, and we wanted to, thought it made sense to have her offer some concluding remarks today. So Deb, please take the floor, and then, we'll move from there.
Thank you, Mark. And I want to thank the MAPC for hosting this incredible event and this opportunity to learn and share ideas to address the opioid crisis across communities. Also, thank you, Mayor Christensen, for your dedication to this issue and the amazing work you're doing in Malden. It really is an example to everyone, and I'm blown away. So thank you for your work. Lastly, thank you to everyone who's joined this series. Just being here is a testament to your dedication to supporting the many people in our communities who are suffering right now from substance use disorders. So thank you so much for that. As mentioned earlier today, to effectively address this crisis, we need to understand the correlation with mental health. In that vein, I wanted to emphasize the importance that treatment be trauma-informed in settings that are safe for those who need healing. My daughter, Becca, was raped when she was 15. She eventually turned to drugs to cope with her trauma. And at 18, when she began substance use treatment, her choices were limited to co-ed facilities with people of all ages and life experiences. She returned from treatment in a worse emotional place than when she entered. And this cycle was repeated a few more times before she died. Every time we were hopeful that this new place would be better, and we just at the time didn't understand that, unfortunately, that it just doesn't work for a young girl who's been raped to be in that kind of treatment environment. So at 18, Becca died from a fentanyl poisoning. She and a friend bought cocaine that was laced with fentanyl. The introduction of fentanyl, carfentanil, and other deadly additives to the U.S. illicit drug supply has made the risk of overdose significantly greater in the last decade. When I lost my daughter in 2020, I had never even heard of fentanyl, despite being mentioned in the National Opioid Health Emergency that was declared in 2017. I still meet people today who are unaware of this threat, and it always surprises me. So what I want to leave you with today is that it is our responsibility, those of us who know, to make sure that every student and every adult in our communities is aware of this risk. Knowing may not have stopped my daughter, and it may not stop others who suffer from the terrible brain disease of substance use disorder, but it'll surely stop many children and young adults and others from purchasing an Adderall online or anything that they believe is safe when they understand that really nothing is safe anymore. Nothing is safe unless you purchase it from a legal pharmacy. So undoubtedly, this knowledge will stop some from moving forward and will save lives. So in addition to all the important steps mentioned today that your community can take, please also make sure that the most basic step is covered, that your communities are talking about this, and that in particular, every middle and high school student knows and is aware of the risk of the contamination of the drug supply. We owe it to our children to make sure they have this knowledge. Thank you all very much for being here. I really do appreciate it, and take care.
Yeah, thank you so much. Thank you so much, Deb, for sharing your story. I mean, I guess if I was trying to think of a few takeaways from the series, and a few kind of words come to mind, and I mean, the first is probably courage, because Deb, you're very courageous for sharing your daughter's story and using it to inform the work you're doing to help others. And I'd say that for a lot of the people who join these sessions, who have shared their stories and are informed by them, and use those to inspire the work they do. All of that is from a very courageous place. So that seems to be a really important quality that we all need to make a difference here. I mean, I think another, and Deb, you mentioned awareness is just I think part of it is we got to keep talking about this. We got to make, and sharing information. I do feel like there's just complacency sometimes around these crises that, a lot of people feel like aren't resolvable or can't be addressed. And we can't accept that. We have to, not become complacent, and we need to keep talking and making people aware of, of the continued risks and continued harm that's occurring. And then just with, like building on what Mayor Christensen talked about, and that was just the kind of ongoing commitment, passion, and dedication, of kind of people, to this issue, and just kind of maintaining that throughout. I think, a lot of times, we sort of wonder, like, how did this community pull that off, or what made that work? And a lot of times it was just like that persistence of, commitment and dedication to this issue. And, I could see why a lot of people get despondent and think, oh, this is all too hard, but we can't look at it that way. And I think, we have to keep working, hard to address this issue. So, it's been really great to meet so many people who are like-minded on that and want to make a difference here and are doing some great things in their communities. And all I'd say is let's keep in touch. MAPC, we will continue to, be a voice on this issue and push an agenda and support our local communities and their partners in addressing it. So thank you all for being a part of these last 3 sessions. Thanks to Deb again for her inspiration to host them, and we'll be, following up and, to continue the collaboration and look at us as a resource. Feel free to get in touch anytime with our agency. So thank you all.